Hello friends, my name is Dr. Puru Dhawan, and in this video we will discuss how we can reduce leg swelling in a kidney failure patient. Leg swelling is a very common symptom in kidney failure patients. What happens when the kidney starts underperforming? Kidney is unable to perform its normal functions. Normal functions like creatinine removal, urea removal along with the fluid removal. And when this extra amount of fluid starts accumulating because of gravity, they start accumulating around your leg region. That causes pitting edema, swollen leg in kidney failure patient. So in this video we will discuss what are the reason behind it and how we can remove this leg swelling with the help of change of diet, lifestyle, and with the help of KFRT treatment. So let's get started. So if we want to remove leg swelling in a kidney failure patient, we have to understand the causes behind it first. We know that when the kidney is underperforming, kidney is unable to perform its normal functions like filtration of creatinine, urea along with the fluid. This extra amount of fluid which gets accumulated in the body causes leg swelling. But there are few more reasons which promotes this accumulation of the fluid, and the number one comes is protein deficiency. In a kidney failure patient, proteinuria is a very common symptom. Means when a patient suffers from kidney is unable to keep the protein inside the body and starts excreting out of protein through urine. This loss of protein on a daily basis causes protein deficiency in the body. This protein deficiency promotes water accumulation in the body, and because of gravity it starts accumulating in your leg region. So if we want to remove leg swelling in a kidney failure patient which is caused by proteinuria, we have to look for something which is good in protein source, and that kind of source which is very high in absorption rate, like egg white and your moong ki dal. If you are vegetarian, moong pulse is very good source of light protein which is almost 100% absorbable by the body. It creates almost nil amount of creatinine in your body. Similarly, egg white is a very good source of protein in a non-vegetarian person. These two proteins are so good that they get absorbed almost 100% in the body, produces zero amount of waste material. That means your creatinine won't increase with the intake of these protein items. Your urea won't increase with intake of these protein items. So we have to take care of the protein what we take in a kidney failure patient, because when the patient starts taking protein in the high amount, what we see that the level of creatinine and urea jumps drastically. Suppose if a patient is suffering from kidney failure, level is around 3 and 4, and he starts taking food item like chicken, mutton, fish, or any kind of other animal protein, what we see that because of this protein, muscle metabolism increases drastically. Because of that high level of metabolism, what happens, the creatinine secretions also increases in the body, which gets reflected within a day. So to avoid that thing, we have to select those proteins which are very easily absorbable by the body. So at Science and Evening, we advise all kidney failure patients to stick to only to these proteins so that the level of creatinine, level of urea can be easily controlled. Now let's move to another cause of leg swelling in a kidney failure patient, and that is sodium. Sodium is an electrolyte which causes accumulation of fluid. So if we want to control the sodium in the body, we have to look for its sources, and the source of sodium is mainly common salt. So if a patient is suffering from high blood pressure and leg swelling, we have to cut down the amount of salt that person take. We have to decrease so drastically that the persons have to take completely salt restricted diet so that the level of blood pressure and the amount of fluid can be managed easily. In a kidney failure patient where the fluid is accumulating in the body, we have to cut down the amount of fluid in the body also. If a person take lesser amount of food and exceed out more amount of fluid than intake, what happens that because of this difference of fluid in the intake and output, body start losing extra amount of fluid from the body, and which results in decreased swelling in the body. But this is a very temporary method of controlling your leg swelling. There is one permanent method which can help kidney failure patient to control not only creatinine, urea along with the fluid, and that is increasing your kidney function. Kidney has a property to excrete out the urea, creatinine along with the fluid from the body. But when a patient suffers from kidney failure, what we do that we almost forgets about the kidney and its function. But when we work on the kidney's function, what happens? Kidney increases its capability to filter out all this waste material. As the functions increases, the level of creatinine decreases, urea decreases, potassium decreases, and the amount of fluid get easily managed in the body. For that, we have to use kidney function restoration treatment. In this treatment at Science Engineering, what we do, we work on the causes of kidney failure. Your kidney is failing because of some kind of reason. It can be BP, it can be sugar, it can be any genetic disorder. So we have to start with the causes of that disease. If you are suffering from kidney failure because of hypertension, we have to manage your hypertension first, because without managing my hypertension, we can't protect your kidney. Because with each and every heartbeat, when the blood enters your kidney with a high blood pressure, what happens? Because of this pressure, it causes damage to your capillary system in the kidney, which decreases the blood supply and causing shrinkage in your kidney. So we have to work on the blood pressure first, just to protect your kidney. Once your blood pressure is in control, what we can say theoretically, that there is no further damage in your kidney. Similarly, in case of diabetes, if you are suffering from kidney failure disease because of your diabetes, we have to work on your diabetes first to make control on your sugar levels, so that there will be no further damage to your kidney. This is the step 1 of kidney function restoration treatment. Now let's move to step number 2. As I told you earlier, kidney function restoration treatment helps to increase your kidney function, and kidney's function increases. Kidney has the function to remove the creatinine, urea, and along with fluid, sodium, everything in the body too. Kidney has function to regulate all these kind of waste material. So as the kidney function increases, kidney increases capabilities to filter out these waste material, and what happens? Level of creatinine decreases, level of urea decreases, level of potassium decreases, and the amount of fluid which is accumulated in your body also decreases in your body, which causes permanent kind of relief in your body. So instead of taking high amount of diuretics and causing damage to your kidney, we can work on your kidney function, because it's the only organ in your body which can perform such kind of function. It's the only organ which can perform dialysis naturally in your body. Instead of managing all symptoms separately, we can manage all symptoms with a single go with the help of kidney function restoration treatment. It will help you to reduce your creatinine level, urea level, potassium, along with your fluid in the body. So I hope now you understand why your fluid is accumulating in your body. It's accumulating because of kidney is functioning low. How we can manage this fluid amount in the body with the help of protein intake or reducing the amount of sodium in the body, and with the help of kidney function restoration treatment. If you have any question, query on kidney failure or kidney function restoration treatment, you can simply ask on the number given below. You can also book an appointment on the same number. You can also visit our website scienckidneycare.com for further information. With this, allow me to say goodbye. See you in the next video.